Welcome to our airway management simulation training with Smart Airway, focusing on emergency surgical cricothyroidotomy. Cricothyroidotomy is an invasive emergency procedure used to establish a patent airway when conventional methods of airway management have failed or are not feasible in the event of a cant intubate, cant oxygenate emergency. A cricothyroidotomy involves making a surgical incision through the cricothyroid membrane to intubate the trachea via the front of the neck. Before performing a cricothyroidotomy, assess the patient's condition and ensure that other airway management techniques have been attempted and deemed unsuccessful or inappropriate. To perform a cricothyroidotomy, place the patient in the hyperextended position. Identify the cricothyroid membrane by palpating the space between the cricoid cartilage and thyroid cartilage. Make a single stab transverse incision through the skin and cricothyroid membrane. Rotate the scalpel 90 degrees, so the sharp end points towards the patient's feet. Slide the cuttae tip of the bougie along the blade into the trachea. Railroad a lubricated ET 6.0 tube into the trachea. Remove bougie and inflate the ET tube balloon. Once the airway is secured, initiate positive pressure ventilation using a self-inflating bag to provide oxygenation and ventilation. Deliver breaths at an appropriate rate and volume. Smart Airway will guide you on the proper technique, ventilation rate, tidal volume, peak inspiratory pressure, and identify complications including failure and instances of bronchial intubation and single lung ventilation.